Condoms, people. Condoms. Wear a condom. Hi, welcome to Fudanshi, where I share LGBTQ and BL media through news, reviews, and good conversation. Today is Monday. That means it's time for a random talk, where I pick a random conversation topic to talk about with you guys, or I pick from the questions, recommendations, suggestions that you guys leave for me in the comments below. And today's topic is actually a kind of, serious, nothing kind of about it, something serious. We're going to be talking about HIV prevention, treatment, and testing. This topic is actually a response to Hanging Out episode 4. If you guys don't know, that is a web series from the Philippines, and the episode actually talked about HIV testing, and I thought that was so wonderful that it inspired me to talk about it here on this YouTube channel. And keep in mind that a lot of the things that I talk about are very biased towards my life, specifically with being in the US, being on a coastal East Coast area that is very populated. Some of the stuff that I talk about may be accessible to me that aren't accessible to you in wherever you live. So just keep that in mind. So yeah, let's just get started. And let's start with prevention. There are many ways that you can actually prevent HIV from happening. And the first and foremost is wear a condom. I think I have a condom somewhere. One sec. What is this? I don't even know what this one is. Condoms, people. Condoms. Wear a condom. I know that this can get hard. I know that sometimes you're in the moment so much that you don't really want to think about it. When I think about risking yourself for sex and kind of risking contracting an STD or pregnancy, I think of Third Rock from the Sun, which was a comedy from America back in the 90s. I think about this one scene where these two characters, I think, had chicken pox or something, and they were scratching each other to feel good or something like that. And one character was berating them and yelling at them, saying, a momentary pleasure for a lifetime of regret and signs or whatever, responsibility. And I was just, the bigger metaphor was about getting a baby or getting an STD, and I always think about that when I'm thinking of unsafe sex or thinking of anything like that. There are different medicines that you can take that you can do to prevent contracting HIV. For instance, there is PrEP, the pre-exposure prophylaxis. Yeah, I got that. PrEP is something that you can use before having sex in order to kind of prevent yourself from actually contracting HIV. So if you continue to use PrEP, you're actually protecting yourself from getting this virus. On top of that, there is also PEP, which I actually didn't know existed until a week or two ago, which is post-exposure prophylaxis. And basically, it's kind of like a morning after pill for HIV. And a little story about how I ended up finding out that PEP existed, because like I said, I didn't know about it until like a week or two ago. I was at home doing nothing on Reddit, Gay Bros, I think, specifically, which is a wonderful Reddit. You guys should go check that out, Gay Bros. But anyway, I was on there just doing whatever, and I saw an ad for a survey, and I thought, I had 30 minutes, sure, I'll take it. The survey was just about trying to find out what gay men are, kind of like sexual awareness and also HIV prevention awareness. One of the questions was, are you taking PEP? And I was like, no, I did not even know that existed. And then at the end of the test, there was also a new survey, which I'll talk about in a second. So moving on to testing, if you guys ever find yourselves in a situation where you feel like you might be in danger of contracting HIV, you can go and get tested. And it isn't, I know it's scary. I get that. I feel that myself sometimes. But it's better to go out and get yourself tested. Like, for instance, I'll share a personal story. There was this one time in college where I felt like I was at risk, right? I found a Planned Parenthood in Center City, Philadelphia. I went, had a very long time of just like getting the whole books and records and everything signed and everything. And then it turns out that my actual health insurance wasn't going to cover it. I looked up free places in my area, and there was actually a free HIV testing center right across the street from where I was. So I went over there, I signed the front and back of one paper handed it in, and literally it was like 3 p.m. on a weekday, so there wasn't anybody there except for like one other person. I got poked in the finger. That's all it is. It's not something like a big needle or anything. It's just a little poke. I talked to whoever it was that was there to talk to me, sort of like a health counselor person, for like, I don't know, 10, 15 minutes, and I got my result. It was that fast, and then I was out the door. Literally, I was there for 30, 40 minutes. Once again, it was pretty empty in the place, but the whole entire process doesn't take that long no matter what. If you feel like you're afraid to go and get tested, you don't have to be. It doesn't have to be a trial. In addition to that, if you feel like you need support outside of the officials who are actually trained for this, you can bring in a family member, you can bring in a close friend, and they are okay with that. In addition to that, the process, once again, does not take forever. It takes seconds. It takes only a few minutes for you to actually get your result once you actually do that. In addition to that, you don't have to go to a health center, right? You don't have to go to Planned Parenthood, something official like that, or to even your doctor. You have options of where you can go. Like I said, I went to Planned Parenthood first, and then it turned out that I couldn't go there because I couldn't pay. So then I went to a free health center right across the street. There are options for you. And then adding on to that, remember when I talked about that survey earlier? At the end of the survey, they were like, do you want to do another survey at a later date? And I was like, I don't know. But apparently they are actually going to send me a take-home HIV test and then have me answer a few questions about that. So there are things like that they are working on, actual take-home HIV tests. And I've also read while I was preparing for this video that there are actually 4th generation HIV tests now that are becoming faster with getting a response, because right now the deal is that if you feel like you have risked yourself with contracting HIV, you're supposed to wait 3 months before the infection would actually show. So that means every 3 months you have to get tested for HIV, even if you don't feel like you're in risk. But just if you are sexually active, you are supposed to get tested every 3 months. But there are actually 4th generation tests now. Excuse that noise. It's windy and a door somewhere opening and closing. But anyway, there are actually 4th generation tests now that are actually starting to be faster with perceiving this infection. So pretty soon, these could be widely dispersed worldwide, and then it would only take a couple weeks for us to know if we have this disease. Lastly, if you actually do have HIV, know that it is no longer a death sentence. You can get proper medication that will protect you. For instance, there's actually 25 different medicines that you can take in order to treat HIV. And then on top of that, they're actually separated into 6 different categories of drug classes. The U.S. Health and Human Services Department actually states that you were supposed to be taking 3 different medicine out of the 25, and then taking from 2 different of the drug classes if you want to actually treat your HIV virus, whatever. It depends on what your specific situation is and how the virus is affecting you specifically. And for that, you will of course need to talk to your doctor, and then they, with you, can decide what kind of medicines you need to be taking. But once again, it's not a death sentence. If you are taking this medicine regularly, you can live as long as people without the infection. But anyway, that's my thoughts on HIV prevention, treatment, and testing. If you guys have any thoughts on this, of course, always feel free to comment down below. And of course, as always, I'll comment back and continue the conversation with you. And of course, as always, if you like this video, make sure to like it, to share it with your friends, and to subscribe if you haven't already. Queer Fudanshi tries to share LGBTQ and BL media through news, reviews, and good conversation. So let's get talking.